Hello, dear students and esteemed learners. Welcome back and welcome to my course on Sociology of Health. This week, we are discussing on the theme Health Expenditure and Universal Health Coverage. And this is lecture number 54. And the topic that I have included for today's lecture is Universal Health Coverage, Definition, Need, and Target. So, although as a title, universal health coverage is coming for the first time, but we have been talking about this concept since long. Basically, whenever we talk about health expenditure or some kind of coverage, then we are talking about universal health coverage also, because as of today, this is the most dominant mechanism, right? We will try to understand what do we mean by universal health coverage, what are the targets, and what kind of basically association it has with the sustainable development goals and all other related things basically, right? So the concept that I have included in this lecture is universal health coverage, meaning given by World Health Organization. Then why do we need to have this universal health coverage, and then what is the background, and then what is its relationship with sustainable development goal, especially the target 3.8, and then how can we measure the progress made in this particular domain, right? These are the things that we will try to understand. With this brief intro, let us go to the first slide. First, we'll try to understand it. Now, as we have been following, whenever a new concept we are going to discuss, we first take the meaning or definition given by World Health Organization, because the meaning given by World Health Organization is something which is finding legitimacy globally, right? And that is the most important agency which is talking about health and all health related issues. We have been following this. So, universal health coverage means that all people have access to the full range of quality health services they need, right? First thing is this, that all people should have access to full range of quality health services when and where they need them without financial hardship. So first, they should get whatever and whenever they need and wherever they need. And second, that should not cause any adverse financial impact on them, because if those services are causing the adverse financial impact, then that will basically have a catastrophic impact, right? So that then perhaps the beneficiary will not remain a beneficiary, right? And what kind of catastrophic impact basically we are talking about? The serious economic implications basically we're talking about. In some of the definitions, these things will become very visible and clear. It covers the full continuum of essential health services basically. So this universal health coverage in principle covers full continuum of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course, right? This is very important. That first, universal health coverage talks about accessibility to health services. Second, it talks about that there should not be adverse financial hardship. And third, that is very important, that it talks about the full continuum of essential health services, and it includes basically the promotion, the promotive health, then the preventive health, then the treatment, that is curative health, the rehabilitation, the palliative care, and across the life course. So across the life course means you can start from anywhere, say from childhood to adolescence to adult to elderly, and then basically again to the newborn, and then childhood, and in between comes the fetus and the womb. So all these basically are the life stages, and these are applicable at each and every stage. That means it is a very comprehensive, very umbrella kind of term. The delivery of these services requires health and care workers with an optimal skills mix at all levels of the health system, right? Then WHO further says that protecting people from the financial consequences of paying for health services out of their own pocket reduces the risk that people will be pushed into poverty, right? If you protect people from the financial consequences, then it will reduce the risk of getting impoverished, because the cost of needed service and treatment require them to use up their life savings, all assets, or borrow, even borrowing the money, or all basically possible uh, or very difficult options which are available for managing to get the kind of money that is required. WHO's 13th General Program of Work aims to have 1 billion more people benefit from universal health coverage by 2025. So that is a kind of goal which is there in the timeline. And then achieving universal health coverage is one of the targets the nations of the world set when they adopted the 2030 Sustainable Development Goals, right, in 2015. So there is a kind of association between Sustainable Development Goal and universal health coverage, as we will see in terms of the target also. Now, why do we need basically? We have understood it, but what kind of crisis basically it will be able to handle, right? Or what is the intensity of the need? The proportion of the population not covered by essential health services decreased by about 15% between 2000 and 2021, with minimal progress made after 2015. That means this UHC or universal health coverage is helping in extending the coverage of the services, and so we need it. It indicates that 2021 about 4.5 billion people were not fully covered, and on the one side the people who are coming under this coverage, that is increasing, but the people who are yet to get the benefits of this coverage, that is a huge number. And when that number is such a big, 4.5 billion people were not fully covered by essential health services, then what kind of mechanism basically we are having at a global level? There's no other mechanism but this universal health coverage, which talks about extending the services so that all people living on planet Earth should get the benefit. Then about 2 billion people are facing financial hardship, including 1 billion experiencing catastrophic out of pocket health spending, or 344 million people going deeper into extreme poverty due to health cost. Now, these are actually very important figures. 344 million people are going into extreme poverty because of the high cost of care. So, on the one side, we are talking about addressing the problem related to poverty. All development goals basically talk about eradicating poverty. That is one side of the coin. And on the other side, because of the medical care, a good number of people are becoming poor. So, both the things cannot go side by side. And if this trend is continuing to be there, then what will happen? Over a period of time, most of the people basically who came or who somehow came above the poverty line will again go back to the below poverty line status. There will be a vicious circle. That means the fruits of development will not benefit people. That will kill the entire purpose of development planning or whatever development we are talking about, right? That means universal health coverage is that intervention which is intending to protect people from falling down to below poverty stage because of that high cost of medical care, right? So you can understand the significance of this concept from this point of view. Then we basically witnessed the COVID pandemic that had disastrous impact globally, world over, and that has actually disrupted the health services and of course the health coverage related things also. But the world is trying to come back to its own design discourse, right? And as of now, the World Health Organization figures suggest that 90% of essential universal health coverage interventions can be delivered through a PHC approach, that is primary health care approach, potentially saving 60 million lives and increasing average global life expectancy by 3.7 years by 2030. This is a very important figure. First of all, that when we are talking about universal health coverage, then what kind of services basically we are talking about? Are we talking about the tertiary services only or the secondary services only? And here you find the answer. Actually, it is stated that 90% of the essential universal health coverage interventions can be delivered through a PHC approach, that is the primary health care approach. And primary health care approach is basically engaging minimum cost. We have seen the figures. And further, most of the national governments are actually talking about focusing on PHC. We have seen that even in India, government is allocating around 55% of the fund to strengthen the primary health care services, right? So by following the PHC approach, this UHC goal could be achieved up to the level of 90%. And what kind of impact it will create? It will enhance the life expectancy by 3.7 years by 2030. This is such a huge number. So in India, basically life expectancy is around 70 years. That means if we follow the pattern and as per these projections and these averages, this will increase by 3.7 years within next 7 or 8 years, 6 or 7 years. So the potential gain is actually huge, right? And that is why we are talking about these topics. Then I have included one slide here that is also giving us some realistic understanding about what kind of actually impact or what kind of share the out-of-pocket expenditure is having in the overall health expenditure, right? Because when we are talking about the universal health coverage, then the goal is basically to talk about two things. First, to extend the services, and second, to minimize the cost, right? Primarily the out-of-pocket expenditure. So if you have a look on this slide, basically that is taken from one of the government documents, and I have mentioned the source also here. You can see the green bar is actually the total health expenditure, and then this orange bar is the out-of-pocket expenditure, and the red is the government, right? So you see the total health expenditure, the out-of-pocket expenditure, and the government health expenditure. We can see that in this particular case, basically in this particular case, the government health expenditure is very less and the out-of-pocket expenditure is very high. So when we have such a high out-of-pocket expenditure, then definitely it will create the catastrophic impact. You see this basically Uttar Pradesh. You can see this orange bar. This is at least three times more than the red bar. That is, the out of pocket expenditure is at least three times more than the government health expenditure. That means the burden on people is very huge. And now these figures are basically the 2016-17 figures, right? So that means till then the impact of out of pocket expenditure was very huge because the government health expenditure was lesser. As we saw in the previous lecture, that over a period of time, gradually the government health expenditure is actually increasing. So with that increase, the burden on out of pocket expenditure is declining, right? So when this is happening, that means we are moving in the direction of health coverage. And so I added this slide so that we get some kind of understanding about how the things were till few years before. Then very briefly, I would like to talk about the background of the universal health coverage system, basically how it came into existence. The member states of the World Health Organization committed in 2005 to develop their health financing system. Basically, way back in 2005, there was an effort to develop a health financing system. What for? For achieving two goals, right? All people have access to healthcare services and do not suffer financial hardship paying for them. So we have been talking about these two things time and again, but I have added this so that you should have an idea that where from we got this information. So basically it was stated in the World Health Organization's document way back in 2005 itself, right? That means the journey towards universal health coverage started way back in 2005, right? Now, there is a link between Sustainable Development Goal and universal health coverage. We discussed Sustainable Development Goals in lecture number 21. That is why I have mentioned this. And there we saw the goals of the Sustainable Development, right? And goal number 3. So we have been talking about the universal health coverage and its link with Sustainable Development Goals also, right? And we have studied the Sustainable Development Goals in one of the previous lectures, basically lecture number 29 I have mentioned here, so that you can get relate this with the previous lecture, right? And there we have stated that the goal number 3 is basically talking about good health and well-being, and then there are several targets. So I have highlighted target 3.8. It says that achieve universal health coverage including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality and affordable essential medicine and vaccines for all, right? So when the Sustainable Development Goal is talking about universal health coverage, then it has already identified good number of issues. Now, not all these issues are basically included in the notion of universal health coverage that we are talking about most of the time. But with time, you may see that these that there are good number of new targets are also added. As of now, we generally talk about target 3.8.1 and target 3.8.2. But over a period of time, 8.3, 8.4, 8.5 may also be added, and that is why we stated earlier also that actually these are evolving because health is dynamic, the needs are dynamic, and so the support systems are also evolving. Target 3.8 of the SDG is defined as achieve universal health coverage including financial risk protection, access to quality essential health care service, and access to safe, effective, quality and affordable essential medicine and vaccine for all. So it talks about basically medicines, it talks about vaccines, It talks about financial risk protection, then quality essential health care services, and safe, effective, quality, and affordable essential medicines. Right? So, all these things basically, this universal health coverage is talking about when that is mentioned in target 3.8 of the SDG. So, the concern is with all people and communities receiving the quality health services they need, including medicine and other health products without financial hardship. So there are indicator 3.8.1 and 3.8.2, right? 3.8.1 talks about health service coverage and 3.8.2 talks about health expenditure in relation to a household's budget. So, what kind of mechanism is available to measure the progress towards universal health coverage? That is an important question. Do we have any system well developed as of now for measuring the progress? The answer would be mixed. Measuring progress towards universal health coverage is complex due to obvious differences in politico-economic context, right? Because we are talking about the things at global level, and we know that there are differences at multiple levels. So, having one specific strategy to measure that basically has not been agreed upon till now. We can say this. In 2015, the World Health Organization and World Bank jointly launched a monitoring framework for UHC and reported the first global assessment of the progress towards UHC, that is Universal Health Coverage. Subsequently, a second report was published in 2017, more specifically monitoring SDG 3 Target 3.8. The second framework built on two SDG UHC indicators, the coverage of essential health services target 3.8.1 and financial protection target 3.8.2. Such an evaluation framework will provide guidance for assessing UHC in a country and tracking progress over time and be meaningful in making cross-country comparison. That means efforts are being made at global level, and there are certain indicators which have been developed, although not in a very quantitative format what we were having for the millennium development goals basically, but yes, that kind of effort is going on. And so in the forthcoming period we can see that there are good number of specific indicators available, right? As of now, the focus is on extending the primary health care services. I would like to talk about the Astana Declaration and the Alma Ata Declaration also. Way back in 1978, the Alma Ata Declaration talked about achieving the goal of health for all, and it also talked about the notion of primary health care. Then, after 40 years of that Alma Ata Declaration, in 2018, there was the Astana Declaration, and it again talked about primary health care. And as we have discussed it in some of the previous lectures also, during that declaration, during that conference, basically, it was realized that the world is actually witnessing disparity, inequity, and inequality. That means those targets have not been achieved till now, right? And as we discussed in one of the previous slides, here, most, that is 90% of essential universal health coverage interventions can be delivered through a PHC approach, potentially saving 60 million lives and increasing average global life expectancy by 3.7 years by 2030, that indicates that we need more political will, and then effective strategy, and then an empowered workforce, right? And then an empowered people, right? So if we see these things in that context, then the goals of universal health coverage are not uh, far away, but for that, a kind of political will is required, participation of people is required, right? And then well oriented health force is also required. Because of a comprehensive approach, now we are in a position to achieve the goals, not only in the context of one country or one state within a country, but at a larger level, right? So this is all that I wanted to talk about in this particular lecture. I have not included the situation related to India in this lecture because it would not have been possible for us to talk about both the things in one single lecture. So we'll talk about the situation related to universal health coverage in Indian context in the next lecture. And this much of understanding basically is going to help us to understand the larger concepts over there. So we will meet in the next lecture, and till then, take care.